So RSV is the virus. And what do you call the infection that is caused by this virus? Of course, it's an RSV infection. So if you look at how this virus behave, if you're familiar with flu, who's familiar with flu? Influenza, okay. Of course, all of you are familiar with COVID. So most of these viruses starts with a mild type of infection. No? Yung sore throat, masakit ang katawan, okay? Nasal congestion, and then a lot of these patients will also have fever. That's how virus behave. But there is a segment or the part of the course of this viral infection that they will go into a severe form of the infection. And when you look at severity of a viral infection, just like what we have experienced with flu or even COVID, sino ba yung natatamaan at magiging severe? Senior citizen. Our experience with COVID will really be a draft back of why we are really looking at this particular virus probably as the next most important virus after COVID, after influenza. Okay? Aside from that, when these people become severe, there's also a lot of higher risk for mortality. Okay? So how does this infection spread? Okay. Just like your viral infection like COVID, it can be spread within 3 feet. If the person is infected, has a symptom, coughing, sneezing, you can get it. But there is also a possibility that any one of us here may be carrying the virus and we don't know that that virus is already spreading here in this particular room. Diba? Bakit nagiging awareness ang mga ganitong virus? Because of the relaxation of the COVID protocol. Hindi na tayo nagpe-face mask no? And that's why when you look at co-circulation of other viruses, nakikita natin yan after COVID pandemic. Lumalabas ang influenza, lumalabas ang RSV because hindi na tayo nag-face mask, no? And that's why most of the source of this infection can be transmitting this to their own household family members. Okay? And same as that when we had that experience with COVID. So, if you're familiar with RO, what is RO? RO is defined as something that ability of once you are infected, how many possible people that you are or you can infect within that vicinity of 3 feet or 4 feet that you are highly infectious. That's between 2 to 3. No? Ang pinaka-highest na RO na highly contagious is what? Measles. Measles is 16. Okay. But during the peak of the Delta and the Alpha virus, in some countries, there was the peak of RO of COVID was 9 to 12. Okay, so ganun yan. Ito, 2 to 3 because we are not in a pandemic type of RSV as of now. No? Sana naman hindi maging ganon. No? But the 2 to 3 is already something that you need to look up because 2 to 3 here is that you are vulnerable, you are in the elderly population, and you have comorbidities. Okay, so is RSV present in the Philippines? Yes, matagal na to, no? So kung titingnan mo tong mga data na to, this was 2010 to 2013, no? And if you look closely on this data, you'll notice that it can also occur. Kasama siya sa influenza during those months na gumawa ng surveillance, no? And ang influenza season natin is usually July. It starts with July, August, and then it peaks October, November, and December. So the same as that with your RSV. Ganun yung peak niyan. It can co-circulate also with influenza. And that's why it's so difficult for us to differentiate a person having the same symptoms during this span of a month or during the span of a year, which is influenza and which is RSV, or even which is COVID. No? So that's the difficulty with differentiating any of this. Pero talagang during rainy season, that's the part of where you need to look at higher peak of this what we call influenza-like illnesses. You remember last year, 2023, September, October, the Department of Health made an alarm that there was an significant increase of influenza-like illnesses. Do you remember that last year? One of the viruses that was also isolated, aside from influenza and COVID, was RSV during that time. Okay, so you would expect that another cycle of the month this year, starting August, September, you will have another influenza-like season. Most likely there will be an RSV in those surveillance. So what is the burden of RSV among senior citizens? Paano to kalala, anong mga komplikasyon ng RSV pag natamaan ang isang senior citizen or those with comorbidities? Okay. Before, we thought that RSV is only present among children, okay? The less than 5 years old. Always look into that, no? The most vulnerable population in children is the less than 5 years old. Kung titingnan mo yan sa WHO priority in terms of vaccine preventable diseases, it's the less than 5 years old. But now we're looking at also the extreme of age, the extreme of less than 5 years old, which is now the 60 years old and above. These are the elderly population. That's how we define elderly population. So it can also, as bad as that, especially if it affects the elderly population. Titingnan mo tong hospitalization. That's how we usually look at it, no? Severity. Ilan ang napunta sa hospital? Hindi lang doon sa bahay. Kasi kung sa bahay and you recovered, okay lang yan. That's good. But if you had this infection and you were brought to the hospital, and then that's something that will entail higher risk of what? Mortality and complication. So 60,000 to 160,000 were hospitalized compared to the less than 5 years old, 58,000 to 80,000. And among those hospitalized, you look at the death, 6,000 to 10,000 deaths. So hindi siya biro because merong namamatay at na-hospital. Okay. So what will make this virus so dreadful among the elderly? Hindi lang siya virus because it's causing sore throat or causing sipon, nasal congestion. It can also cause what? Lung infection, pneumonia. It can also cause exacerbation of certain comorbidities, no? Mamaya si Dr. Lenny will also discuss a patient with comorbidity, paano nagiging lumala ang comorbidity, kagaya ng asthma, kagaya ng COPD, to the point that they can also die because of the infection. Okay. Cardiovascular complications, itong palagi natin binabantayan because a lot